The nurse stood and spoke with them, encouraging the slow deep breaths to relax as they talked. It was shared that they were worried about the surgery, if the appendix might rupture, and whether he was well enough to deal with the surgery and recuperation.
My diabetes and hypertension, I don't heal very well, and if I get an infection, I don't know if I can fight that.
When asked about the supports they would have going home, Mrs. B said they had 3 grown children, married and living within the city limits, who knew what was going on.
Their lives are so busy, I can't see them being able to help us much.
The nurse reassured them both and said, I understand that you are worried about the surgery, about what might happen during it and then after too. I want to reassure you that we will help you through this and that there are a lot of supports here and in the community to assist with that. First of all, is your pain any better?
That it had eased, and rated it as 7/10.
Good. I need to update the doctor about your blood sugar and vitals. Would you like me to have him come in to speak to you about the surgery?
Yes, please.
That would really help, I have so many questions.
I can also have the diabetic educator come in to meet with you, and he can arrange with your family doctor, and the community health nurse to help you, once you get home with your diabetes, the wound healing and your concerns there. There is also the social worker, who could come to speak with you, to help you speak to your family about your concerns. Maybe they don't know how, or if you want them to help. You don't have to answer that now, think about those ideas and let me know what you think. In the meantime, it would be nice if you can have some support Mrs. B while Mr. B is in surgery. Is there someone you could call to be with you? The nurse assisted Mrs. B in making a call to a good friend to come and be with her. Both she and Mr. B expressed their appreciation to the nurse for listening to their concerns and providing suggestions to help address their concerns. According to Imogene King, assessment occurs during interaction. After talking to the patient, nurse come to know client's perception about his concerns and started to work together to develop nursing diagnosis to deal with patient's anxiety related to surgical procedure and wound healing. He is also concerned about pain after surgery. Nursing goal. The goal of the theory is to have an open communication between patient and nurse to establish goals and then to formulate plan for attainment using nursing process. These are the identified nursing diagnoses. 1. Anxiety related to surgical procedure. 2. Pain related to acute abdominal discomfort. 3. Deficient knowledge related to surgery, wound treatment and home care. 4. Increased risk of infection and decreased skin integrity related to underlying diabetes. 5. Risk of infection related to possible rupture of appendix. Client's goal for anxiety related to surgical procedure. 1. Patient describes own anxiety and coping patterns. 2. Patient demonstrates improved concentration and accuracy of thoughts. 3. Patient demonstrates ability to reassure self. 4. Patient maintains a desired level of role function and problem solving. 5. Patient monitors signs and intensity of anxiety. Anxiety related to surgical procedure. Nursing interventions and rationale. 1. Early monitoring of signs and symptoms of anxiety such as increased HR and blood pressure. This will allow nurse to develop nursing priorities to work on. 2. Active listening to clients' concerns, display warmth and clear all queries will help to build trusting nurse-client relationship. 3. Encourage client to talk about stressors that will allow him to express feelings and help to develop therapeutic relationship. 4. Provide necessary information about surgical procedure to increase knowledge and reduce anxiety. 5. Stay with client and ask short and simple questions because patient needs reassurance during panic attack. Client's goal for pain related to acute abdominal discomfort. 1. To control the pain or manage. 2. To improved well-being such baseline level of vital sign and relaxed muscle tone, facial expression and posture. 3. Patient uses pharmacological and non-pharmacological pain relief and strategies. 4. Patient shows improvement in mood and coping. Pain related to acute abdominal discomfort. Nursing interventions and rationale. 1. Early assessment of location, quality, intensity and type of pain help and pain management planning. 2. Assess client's cultural, environmental and other factors that may contribute to pain relief and help in understanding about patient's perception of pain. 3. Maintain semi-Fowler's position to reduce abdominal tension that will help to reduce pain. 4. Keep client nothing by mouth to decreases discomfort of early intestinal peristalsis, gastric irritation. 5. Apply ice pack and administer analgesics to relieve pain through desensitization of nerve endings. 6. Watch closely for further complications to deal with them timely. Client's goal for deficient knowledge related to surgery, wound treatment and wound care. 1. To educate the patient about his surgery, wound treatment and home care. 2. Patients explain disease state, recognize the need for medications and understand treatments. 3. Patients show motivation to learn. 4. Patient lists resources that can be used for more information or support after discharge. Nursing interventions and rationale for deficient knowledge related to surgery, wound treatment and home care. 1. Provide accurate, honest information to patient about the procedure and the process of healing. Being informed about progress of situations provides emotional support and helping to decrease anxiety related to surgery. 2. Encourage early ambulation promotes normalization of organs function. 3. Identify symptoms requiring medical evaluation, increasing pain, edema or erythema of wound, presence of drainage, fever. Prompt intervention reduces risk of serious complications, delayed wound healing.
Client's goal for risk for infection related to underlying disease and possible rupture of appendix. 1. Patient remains free of infection, as evidenced by normal vital signs and absence of signs and symptoms of infection. 2. Early recognition of infection to allow for prompt treatment. 3. Patient will demonstrate meticulous hand washing technique. Nursing interventions and rationale for increased risk of infection and decreased skin integrity related to underlying diabetes. 1. Check on bony prominences such as sacrum, scapulae, inner and outer knees and back of the head, because these specific areas are at higher risk for skin breakdown. 2. Use an objective tool for pressure ulcer risk assessment. It's used to assess if patient's condition changes. 3. Assess for fecal or urinary incontinence. With the use of diapers and incontinence pads hastens skin breakdown. 4. Assess for edema. Skin tightening totally over edematous tissue is at risk of skin impairment. 5. Dermatitis or exposure to chemical irritants. These conditions can cause inflammation, resulting in redness and itching and may cause blisters.
Nursing interventions and rationale for risk of infection to possible rupture of appendix. 1. Practice and instruct in good hand washing and aseptic wound care. Encourage and provide perineal care. It helps to reduce risk of spread of bacteria. 2. Monitor vital signs. Note onset of fever, chills, diaphoresis, changes in mental status, and reports of increasing abdominal pain. Suggestive of presence of infection or developing sepsis, abscess, peritonitis. 3. Administer antibiotics as appropriate. Antibiotics given before appendectomy are primarily for prophylaxis of wound infection and are not continued post-operatively. Therapeutic antibiotics are administered if the appendix is ruptured or abscessed or peritonitis has developed. 4. Prepare and assist with incision and drainage, I&D, if indicated. May be necessary to drain contents of localized abscess. 5. Watch closely for possible surgical complications. Continuing pain and fever may signal an abscess. Evaluation. 1. Client response to intervention teaching, and actions performed. 2. Client demonstrates involvement and participation in his care and discharge plan. 3. Client goals addressed and progress toward desired outcome. 4. The nurse and patient check in to evaluate if the goal and objective was achieved. 5. Client is satisfied with outcome of interventions and actions performed by the nurse. As nurses, we are accountable for our practice and applying King's theory of goal attainment, being aware of and applying the concepts within the personal, interpersonal and social realms, having effective communication in all aspects and striving for mutual goal setting from a client-centered perspective, supports the attainment of these standards. King's theory also reflects the well-understood and applied nursing process method. Nursing process is a system of interrelated actions, and King's theory is a system of interrelated concepts that reflect nursing process as a theory. This is the Group 10. We're signing off. Thank you for watching.